Phillip Island is located just 90 minutes from Melbourne in the beautiful Bass Coast Shire, famous for the penguins, the surf beaches and a place of natural beauty abundant with wildlife. Wally Hospital was a much loved private hospital on the island for many decades, growing from community contributions, but sadly this facility closed in 2008, leaving a healthcare gap on the island. The gap was bridged by the Phillip Island Health Hub, which opened in April 2018. The $5.8 million project, funded jointly by the Federal Government, the Victorian Government and the Wally Trust, was constructed on land provided by Bass Coast Shire Council, truly a collaborative effort. Welcome to the Phillip Island Health Hub. My name is Kirsten. Please sanitise your hands and put a mask on before you enter, and we will assist you with signing in with our QR codes as part of our COVID Safe plan. Please, come this way. This is the inside of our Phillip Island Health Hub, opened by Bass Coast Health in 2018 to provide person-centred care for the Phillip Island community and visitors. The hub includes an urgent care centre with a doctor and nurse available 24 hours a day, 7 days a week in a secure environment. The hub also offers outpatient services including specialist medical consulting, allied health for adults and children, maternal health, community nursing and rehabilitation.
Hello, my name's Liam. Come this way. I'm the current nurse unit manager here at the Urgent Care Centre. When you present to the clinic, you'll be asked to come and see the triage nurse. She'll triage you and give a brief assessment, and then you'll be asked to move across to the reception where they'll get all your details, put you on the system. Once that's sorted, we'll either take you straight through to the department or we'll ask you to wait for your turn in the seating here. So we're a 24-hour, 7-day-a-week service, servicing the Phillip Island community as well as the visitor population that regularly attends the island. We have 4 bays, they're all cardiac monitored. This bay here is what we call the resus bay, so it's got the equipment necessary, including the bedside ultrasound machine. We have telehealth video conferencing if required, and slit lamps. And this here is the nurses station. Okay, this is our isolation room. So if we need to isolate any of our clients from the rest of the department, we bring them in here, which is such conditions of gastro and respiratory illnesses and the like. Just enables us to keep them away from the rest of the clients in the department.
This area was constructed in the existing footprint in the large community meeting room. The space constraint created some limitations in terms of the current design, and it is therefore planned that a new and expanded urgent care centre will be developed in the new community hospital. The current plans see the existing urgent care centre area transition to a front of house dental service. The hub has 2 administrative bases, one for the urgent care and one for the remaining services. The urgent care area is staffed 24 hours a day, whilst the other areas staffed Monday to Friday from 9:15 to 5:15. Recent medical records are stored on site, and this space is already very tight. Work is commencing on an electronic medical record, which will aim to take the hub into a paperless space. This journey is expected to take many years. When the hub first opened, it provided a number of community services, which were relocated from a building rented in Wally Avenue. These include physiotherapy, counselling, speech pathology, dietetics, alcohol and other drug services, clinical nurse consulting, health promotion, health independence programs, social work, and counselling and child, youth and family services. A number of new services that had previously only been provided from Wonthaggi were introduced to the hub, the most important being a significant number of medical specialists. These medical specialist services have continued to grow over the years with the hub now facilitating access to ophthalmologists, cardiologists, endocrinologists, surgeons, haematologists, oncologists, geriatricians, urologists. Ophthalmology equipment has been recently added with the Commonwealth funding. These specialist services have greatly reduced travel time for Phillip Island community members, and over time, as funding becomes available, more and more of these services will transition to public clinics, which will mean there'll be no cost to the patient. Importantly, much of the equipment in the hub has been funded through the generosity of the Phillip Island community. Staffing numbers vary from day to day, depending upon which services are provided on the day. The model of care is that all allied health, specialist and community services are provided from both the Cows and Wonthaggi sites, delivered by Bass Coast staff who mobilise themselves rather than the clients. The Urgent Care Centre can see up to 60 patients a day in peak times, with most presentations occurring between 9 a.m. and 7 p.m. The Urgent Care Centre is available overnight. Specialists can see up to 40 patients a day. Allied Health up to 40. All allied health and specialist services can be organised by phoning Access Department on 5671 3175. One of the key successes of the hub is its integration with Wonthaggi Hospital and expanding sub-regional service. The key goal for all health services is to make sure that the care that is provided is safe and of high quality. The best way to do this is to make sure each health service understands their capability and that they don't work out of their capability. Instead, Bass Coast Health has strong partnerships with bigger health services like the Alfred and Monash, so that sicker, more complex patients get their care and facilities designed and staffed to look after these sicker patients. Phillip Island has a significantly high number of young families and children. One of the key clinical goals for Bass Coast Health is to bring paediatric services to Wonthaggi Hospital and the Health Hub as part of the community hospital expansion, so that specialist multidisciplinary care can be provided from the hub. Like all health services, the hub has had to make significant changes to its model of care and its procedures to make sure staff, visitors and patients are safe in this unprecedented pandemic. COVID testing has been available at the hub since the beginning of the pandemic, the only walk-in testing service in the state that provides 24 hours a day, 7 days a week. Like all other health services, telehealth has become a usual way of working with some patients. The new Phillip Island Community Hospital is expected to be completed in 2024. It will feature an on-site pharmacy, noting this will not be a retail outlet, renal dialysis, chemotherapy, day procedure area, diagnostic imaging, public dental services, increased community, allied health and family violence support services, and importantly, mental health services. The state government has purchased the land next door to ensure there is an integrated site for all health services. The site is ideally located next to the Cows Transit Centre, providing excellent public transport access. The Health Hub has been welcomed by the Phillip Island community, and there is much excitement and anticipation about the continued growth of safe, high-quality public services. Once the Phillip Island Health Hub has incorporated the new community hospital services in 2024, Phillip Island residents and visitors will enjoy a comprehensive range of public health services locally.